mamas! Today I'm going to be going in depth about mastitis and what you can do to treat it and make yourself as comfortable as possible. Before we get started, don't forget to like, subscribe, and turn notifications on so you don't miss out on any future videos. Lactational mastitis is a condition in which a woman's breast becomes painful, swollen, and red. It is most common in the first 3 months of breastfeeding. Initially, engorgement, which is that swollen, heavy, full breast when your milk comes in, that occurs because of poor milk drainage, probably related to nipple trauma with that swelling and compression to one or more of your milk ducts. If problems with that drainage persist beyond 12 to 24 hours, that stagnant milk becomes infected and lactational mastitis develops. Since breast milk contains bacteria, this is how you get an infection, and this is characterized by pain, redness, fever, and tiredness. There are many options to help you with that mastitis if it does develop. The first is antibiotics. If you have an infection, a 10-day antibiotic course is usually needed. It's important to take all of the medication to minimize your chance of reoccurrence. If your mastitis doesn't clear up after taking antibiotics, follow up with your doctor. And your doctor is going to be the one to tell you if antibiotics are necessary. Usually, when you have a fever that's sustained, you can get really high fevers with mastitis. You need an antibiotic to get better once it gets to that point where it's infected. If you don't get those antibiotics, you can have all kinds of other problems such as an abscess form. So it's really important that you feel as though you're getting a fever or you are developing that mastitis that you call your healthcare provider. Your doctor may also recommend pain relievers over the counter, such as acetaminophen, Tylenol, or ibuprofen. This can help with that inflammation. Your doctor is going to tell you which one is best for you. It's also safe to keep breastfeeding, and breastfeeding can actually help relieve that lactational mastitis. Breastfeeding actually helps clear the infection, and weaning your baby abruptly in the event of developing mastitis actually can worsen your signs and symptoms. You also may be referred to a lactational consultant, and if you do develop mastitis, I strongly recommend you reach out to one. And if you don't know of any lactation consultants, ask your doctor who they recommend. They might refer you to a lactation consultant for help and ongoing support. Suggestions for adjusting your breastfeeding techniques might include avoiding prolonged overfilling of your breasts with milk before breastfeeding. Try to ensure that your infant latches on correctly, which can be difficult when your breast is engorged. Make sure to subscribe to the channel because I make a ton of videos, and one really helpful one is how to deal with breast engorgement, which is very, very common for many women in the beginning of their breastfeeding journey when their milk comes in. If your breasts are really engorged, expressing a small amount of milk by hand before breastfeeding or latching baby on might actually help with that engorgement. Massaging your breasts while breastfeeding or pumping can also help with preventing mastitis, and if you have mastitis already, massaging the breast while you're breastfeeding, especially in the affected area down towards your nipple, can really help clear that clog. Making sure that your breast drains completely during breastfeeding can also help prevent mastitis. If you have any trouble emptying a portion of your breast, apply warm and moist heat to the breast before breastfeeding or pumping. And then if you do develop mastitis, ice is your friend in that scenario. Cold showers, ice if you develop mastitis. And then as you're trying to drain the breast of milk, you're going to want to use warm. So to try and get more milk out and help with milk flowing, you're going to want to use warm compresses. And if you have an infection and in between feedings, ice really helps. You're going to want to breastfeed on the affected side first when you have mastitis. And when your infant is hungrier and sucking more strongly, you're going to want to start them on the side that is dealing with the mastitis because that will help get out any clogs. If you already have the mastitis, it helps get the milk flowing. Another great tip to avoid mastitis altogether is varying your breastfeeding positions. Depending on what position you're using, your baby is latched differently. They're in a different position, which uses different milk ducts. So if you rotate positions frequently and you don't always do the same breastfeeding position, you actually use the milk ducts more evenly, which can help prevent that lactational mastitis. And if you haven't already, I made a video on breastfeeding positions, so make sure to check it out. You also can use cold compresses and castor oil compresses. This is used once you clear a plugged duct to relieve the symptoms of mastitis. So again, it's really important that you clear the clog, whether it's using your breast pump or hand expression, warm compresses, warm compresses, warm compresses when you're trying to clear a clog. And then once you clear it, that's when you start using the ice. If hard portions of your breast still will not drain, you can try therapeutic breast massage. I make a ton of videos. You can check out my videos on lymphatic drainage and breast massage, which I'll link up here for you to help if you develop mastitis. You're gonna wanna massage your breast, especially in the affected area, and you can even use an electric toothbrush or massager and help move those harder portions and put it directly on where you feel the clog. Usually you'll feel a lump under your breast. You're gonna apply it right to that lump, and you're gonna try and hand express, pump, or nurse your baby while applying that electric toothbrush or massager. My third for you, if you have mastitis, is sunflower lecithin. This is a controversial one. Many women swear by it. They say it helps. Other women say it really does nothing. Sunflower lecithin is believed to thin your milk. And again, make sure you check with your healthcare provider before starting any supplements. It's a natural supplement, but it's important to check in with your healthcare provider. It can cause gassiness in your baby, so if you notice any gassiness, that's important to report to the pediatrician or your healthcare provider, and maybe it's not something you want to take. But many women swear by sunflower lecithin because it actually can thin the milk and help the milk drain more easily from the breast and prevent clogs. So something to consider. Another thing is something called Happy Ducts. This is also another natural supplement, and you can take this, you add it to some water, and that is believed to prevent mastitis or treat mastitis. And again, make sure to check in with your healthcare provider that this is safe to take for you, since no two moms are exactly alike and no two babies. And the fifth thing is probiotics. This is really important if you are taking antibiotics because of a mastitis infection. So you want to counteract the fact that you're taking some heavy-duty antibiotics. Many times it's a 10-day course if you develop a mastitis infection, with some probiotics, because antibiotics can be extremely hard on your gut. You might want to talk to your healthcare provider about incorporating some probiotics in, especially while you're on these antibiotics. If you have mastitis, you're going to want to continue ibuprofen and other anti-inflammatory foods such as turmeric. I really like taking turmeric supplements myself personally because it's an anti-inflammatory, or incorporating ground turmeric into my diet, into my foods. It can help with inflammation in the body, and mastitis is a lot of inflammation. And my last tip I have for you is to pump to comfort as necessary. Now, while pumping increases your milk supply, and you might be dealing with this engorgement and oversupply of milk, which may have led to your mastitis, can occur for many reasons. That can be one of them. And you're thinking right now, why would I pump? That's just gonna make more milk. It's gonna make the problem worse. But sometimes you're just so uncomfortable, you have to pump, you have to get the milk out. So while your body is gonna take that input and try and give more milk as an output, you can ease back on the pumping once you get this clog resolved. So pump to comfort as necessary. You don't need to completely drain the breast, but you need to pump to where you're comfortable. It can be a last resort. Unclog and then pump just to make sure you're comfortable. I hope that this video and all my other videos on breastfeeding are helpful. Make sure you subscribe to my channel for all things breastfeeding and giving your baby the best start possible. Thanks so much. I'll see you in the next video.